Making a medical practice youth-friendly is not just about the doctor being a really youth-friendly doctor who can give that young person time. It's very much about the practice as well, because a young person isn't going to know, in fact, that that doctor is a cool doctor until they walk through their door. They first have to ring up and make an appointment, talk to the receptionist, come in and possibly register, sit in the waiting room. So there's lots of really practical things that can happen before they walk through the doctor's door. So we often encourage GPs to offer their receptionists some training as well in how to be youth-friendly, to talk about payment options, to talk about things like confidentiality, or explain that the doctor would like to see them by themselves, this sort of thing. Once they come into the waiting area, it's really nice for a young person to feel that there's material in the waiting room that's relevant to them. I hear a lot of young people say that there were no youth magazines or reading material or posters on the wall made them feel like it wasn't a welcoming place for young people. So there are a couple of things that can be done, I think, to make the practice seem youth-friendly. There's lots of other really important things we know from research that's looked at barriers. So things like cost and Medicare cards, and how easy it is to get to the practice, what the opening hours are, how quickly they can get an appointment, what the waiting times are like. These things are important to all people, but particularly so for a young person, especially if they're starting to do this on their own and you're wanting to encourage them to take those steps towards independence. It's important that they feel quite welcome in that practice and not feel like it's just a place for older people.
For GPs to be adolescent friendly, it's not talking down to them would be the start, because when you're in that time space, a lot of people can feel, you're being condescending if you're talking to them like a little kid. But equally, they want that support, because you need to be asking them about their life, because teenagers are very involved in their own life, and you want your GP to be asking you that sort of thing about, what are you doing, how are you going?
So I think it's very much about being genuine and being empathic, being non-judgmental, and what I mean by that is to not jump in and impose your moral opinion on what's going on, but actually to listen to what a young person's telling you. To get to know a young person does take time. It takes probably more time than it takes with an adult or a younger child. So it is about spending that time getting to know who they are. What I've always said to GPs and nurses when I'm doing some training with them is, for example, don't make your goal in this consultation diagnosing what the problem is. Make your goal engaging this young person to trust you. That is the best goal of all, because a young person will vote with their feet and they won't come back. And if they don't come back to you, it's quite likely that they also will think all doctors are going to be the same and treat them the same. And we're then really doing them a great disservice. So just take your time and make it the priority to really engage this young person as a person, make them feel like they count. Introduce yourselves, tell them your name, ask them what they would like to be called by. If they're there with a parent, make sure you focus on the young person, involve the parent, but try to spend time with that young person alone, and certainly address them as the main patient. A few little tips like that can, I think, help young people feel much more like they're not just being treated like a number.